Question 1. A nurse is preparing to administer medication to a patient. Which of the following is the most crucial step to ensure patient safety before administration? A. Checking the medication expiry date. B. Asking the patient if they have taken this medication before. C. Verifying the patient's identity using at least 2 identifiers. D. Documenting the medication administration immediately after preparing it. Answer: C. Verifying the patient's identity using at least 2 identifiers. This question tests the concept of safe medication administration, specifically focusing on patient identification as a fundamental safety measure. The keyword "most crucial step" highlights the importance of correctly identifying the patient to prevent medication errors. Always checking a patient's identity using 2 unique identifiers, such as their name and date of birth, ensures the right medication is given to the right person. For instance, if 2 patients have similar names, proper identification prevents a potentially harmful mix-up. Remember, ensuring you have the correct patient is the first and most critical step in preventing errors before any medication leaves your hand. Question 2. According to the NMC code, what is the primary purpose of obtaining informed consent from a patient? A. To protect the healthcare professional from legal action. B. To ensure the patient agrees with the treatment plan. C. To respect the patient's autonomy and right to make decisions about their care. D. To document that the patient has received information about their condition. Answer: C. To respect the patient's autonomy and right to make decisions about their care. This question addresses the core ethical principle of informed consent as outlined by the NMC code. The phrase "primary purpose" directs attention to the fundamental reason for obtaining consent, which is rooted in patient autonomy. Informed consent ensures patients fully understand their condition, treatment options, potential risks, and benefits, empowering them to make their own choices about their health. For example, a patient must understand why a procedure is necessary and what it involves before agreeing to it. Always remember that respecting a patient's right to decide for themselves is paramount in all care decisions. Question 3. A patient suddenly becomes unresponsive and is not breathing normally. What is the immediate first action a nurse should take? A. Call for help immediately. B. Begin chest compressions. C. Check for a pulse. D. Open the airway. Answer: A. Call for help immediately. This question tests immediate actions in an emergency, specifically focusing on basic life support principles. The keywords "suddenly becomes unresponsive" and "is not breathing normally" indicate a critical situation requiring prompt intervention. The very first step in any emergency is to ensure safety and call for help or activate the emergency response system, as this mobilizes resources and additional staff. For instance, if you are alone, shouting for help alerts colleagues who can assist or bring emergency equipment. Always remember, in a medical emergency, your first priority after ensuring safety is to get help to the scene. Question 4. When administering a subcutaneous injection, what is the most appropriate angle for needle insertion? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: C. 45 degrees. This question assesses knowledge of medication administration techniques, specifically regarding subcutaneous injections. Subcutaneous injections deliver medication into the fatty tissue just under the skin. A 45-degree angle is generally recommended for most subcutaneous injections, especially when using a standard needle length, to ensure the medication reaches the intended tissue layer without penetrating muscle. For example, insulin is often given subcutaneously at this angle. A useful tip is to remember that subcutaneous typically means a 45-degree angle, while intramuscular is 90 degrees and intradermal is 15 degrees. Question 5. A nurse observes a colleague consistently failing to wash their hands between patient contacts. What is the nurse's ethical responsibility according to the NMC code? A. To ignore it, as it is not directly impacting their own patients. B. To report the colleague to their line manager or the NMC. C. To offer to help the colleague with their workload. D. To speak to the colleague privately and explain the importance of hand hygiene. Answer: D. To speak to the colleague privately and explain the importance of hand hygiene. This question tests professional accountability and the duty to uphold standards of care as per the NMC code. The key phrase, consistently failing, indicates a recurring issue that poses a risk to patient safety. The initial and most appropriate ethical action is to address the issue directly with the colleague, providing an opportunity for them to correct their practice. For instance, a gentle reminder about infection control policies can often resolve the situation effectively. If the issue persists after a private discussion, then escalating the concern to a manager becomes necessary. Always remember that professional accountability starts with addressing concerns directly with colleagues in a supportive manner first. Question 6. A patient is experiencing severe pain postoperatively. Which of the following pain assessment tools would be most appropriate for an adult who is alert and oriented? A. Wong-Baker Faces Pain Rating Scale. B. Flack Pain Scale. C. Numeric Rating Scale, NRS. D. Abbey Pain Scale. Answer: C. Numeric Rating Scale, NRS. This question focuses on appropriate pain assessment tools for different patient populations. The clue adult who is alert and oriented is crucial, as it indicates the patient can understand and quantify their pain. The numeric rating scale, NRS, asks patients to rate their pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst possible pain, making it ideal for cooperative adults. For example, asking on a scale of 0 to 10, "How would you rate your pain right now?" provides a clear, measurable response. Keep in mind that other scales are for children or patients with cognitive impairments, so choose the tool that best fits the patient's ability to communicate. Question 7. What is the normal range for an adult's respiratory rate per minute? A. 8 to 12 breaths. B. 12 to 20 breaths. C. 20 to 24 breaths. D. 24 to 30 breaths. Answer: B. 12 to 20 breaths. This question assesses foundational knowledge of normal physiological parameters, specifically focusing on vital signs. The normal range for an adult's respiratory rate is an essential piece of information for monitoring patient health and detecting abnormalities. A healthy adult typically breathes between 12 and 20 times per minute at rest. For instance, a respiratory rate consistently above 20 or below 12 could indicate an underlying issue that requires further assessment. Always remember these baseline vital sign ranges, as they are key indicators of a patient's overall well-being. Question 8. Before administering any prescribed medication, what are the 5 rights that a nurse must always check? A. Right patient, right drug, right dose, right route, right time. B. Right doctor, right diagnosis, right documentation, right dispenser, right duration. C. Right patient, right room, right reason, right review, right response. D. Right policy, right procedure, right prescription, right pharmacist, right place? Answer: A. Right patient, right drug, right dose, right route, right time. This question tests fundamental principles of medication safety, specifically the 5 rights of medication administration. This widely recognized framework serves as a critical checklist for nurses to ensure safe practice and prevent errors. Each right represents a crucial verification step, such as confirming the correct patient before administering medication. For example, always double-checking the drug name against the prescription prevents giving the wrong medication. Embracing these 5 rights rigorously ensures the safe and effective delivery of all prescribed treatments. Question 9. A patient with a urinary catheter complains of discomfort and there is no urine drainage for the past 2 hours. What is the nurse's initial action? A. Remove the catheter immediately. B. Administer a diuretic. C. Check the catheter tubing for kinks or blockages. D. Encourage the patient to drink more fluids. Answer: C. Check the catheter tubing for kinks or blockages. This question assesses problem-solving skills related to common catheter complications. The keywords discomfort and no urine drainage are critical clues indicating a potential obstruction in the catheter system. The initial and safest action is to systematically check for easily reversible causes like kinks, twists, or blockages in the tubing, as these are common reasons for lack of drainage. For instance, sometimes a patient might unknowingly lie on the tubing, causing a kink. Always remember to assess the simplest potential causes first before escalating to more complex interventions. Question 10. When documenting an incident involving a patient fall, which of the following is most important to include in the incident report? A. Speculation about the cause of the fall. B. A detailed account of the patient's personal history. C. Objective, factual observations and actions taken. D. The nurse's feelings about the incident. Answer: C. Objective, factual observations and actions taken. This question focuses on accurate and professional documentation practices, particularly in the context of incident reporting. The keywords most important to include emphasize the need for precision and impartiality in such reports. Incident reports must always be objective, containing only factual observations, the exact sequence of events, and the interventions carried out. For example, stating patient found on floor next to bed, assisted back to bed, vital signs stable, doctor notified is factual and objective. Always remember to stick to the facts and actions taken, avoiding opinions, assumptions, or personal feelings. Question 11. What is the main purpose of using personal protective equipment, PPE, during patient care? A. To keep the healthcare environment clean. B. To protect the healthcare worker from exposure to hazards and prevent transmission of infection. C. To make patients feel safer during procedures. D. To comply with hospital budget guidelines. Answer: B. To protect the healthcare worker from exposure to hazards and prevent transmission of infection. This question addresses a core concept in infection prevention and control, the purpose of PPE. The keyword main purpose highlights the primary reason for its use. PPE acts as a barrier to protect both the healthcare worker from potential exposure to infectious agents and to prevent the spread of these agents to other patients or the environment. For example, wearing gloves prevents direct skin contact with blood or body fluids, thereby reducing the risk of contamination and transmission. Remember, PPE is a two-way shield, protecting you and your patients from infection. Question 12. A patient expresses reluctance to take their prescribed medication, stating they don't like how it feels. What is the nurse's most appropriate initial response? A. Tell the patient they must take the medication as prescribed. B. Document the refusal and notify the doctor. C. Ask the patient to explain their specific concerns and feelings about the medication. D. Offer to hide the medication in food or drink. Answer: C. Ask the patient to explain their specific concerns and feelings about the medication. This question tests effective communication and patient advocacy in medication management. The patient's reluctance and "don't like how it feels" are crucial clues indicating a need for further exploration. The most appropriate initial action is to engage in therapeutic communication by actively listening to and understanding the patient's specific concerns. For example, the patient might be experiencing unpleasant side effects that can be managed, or they may have misconceptions about the medication. Always remember that understanding a patient's perspective is vital for promoting adherence and shared decision-making in their care. Question 13. When assisting a patient with personal hygiene, such as bathing, what is the most important principle to maintain? A. Speed and efficiency. B. Patient independence and dignity. C. Strict adherence to a fixed schedule. D. Use of the most expensive products. Answer: B. Patient independence and dignity. This question focuses on fundamental principles of person-centered care, particularly regarding personal hygiene. The keywords "most important principle" highlight the ethical and compassionate approach to assisting patients. Maintaining a patient's independence and dignity means involving them in their care decisions, respecting their privacy, and empowering them to do as much for themselves as possible. For instance, offering a bed bath while ensuring privacy with screens and allowing the patient to wash parts of themselves fosters respect. Always remember that patient dignity and fostering independence are paramount, even during routine care activities. Question 14. What is the initial action when a nurse discovers a new, unexpected wound on a patient's sacrum? A. Apply a dressing immediately to prevent infection. B. Notify the patient's family about the wound. C. Document the wound, assess its characteristics, and implement a care plan. D. Turn the patient to the side to relieve pressure. Answer: C. Document the wound, assess its characteristics, and implement a care plan. This question assesses a nurse's immediate response to a significant patient assessment finding, specifically a new wound. The keywords "new," "unexpected wound" indicate a potential skin integrity issue, such as a pressure injury, requiring systematic management. The initial action involves thoroughly documenting the wound's size, location, depth, and other characteristics, followed by assessing its probable cause and initiating a care plan to prevent worsening. For example, this might involve turning schedules, specialized mattresses, and appropriate dressings. Always remember that prompt assessment and documentation are crucial for effective wound management and preventing complications. Question 15. A patient with a known allergy to penicillin is prescribed amoxicillin. What is the nurse's most appropriate action? A. Administer the medication as prescribed, but monitor for allergic reactions. B. Administer the medication and document the allergy for future reference. C. Withhold the medication and contact the prescribing doctor immediately. D. Administer a smaller dose of the medication to test for a reaction. Answer: C. Withhold the medication and contact the prescribing doctor immediately. This question tests critical thinking and safety in medication administration, specifically concerning patient allergies. The key information: known allergy to penicillin and a prescription for amoxicillin, which is in the penicillin class, represents a serious, potentially life-threatening medication error. The nurse's most appropriate and safe action is to immediately withhold the medication and contact the prescriber to clarify and obtain an alternative. For instance, administering amoxicillin to a patient with a penicillin allergy could lead to anaphylaxis. Always remember that patient safety always overrides a prescription when there is a clear contraindication like an allergy. Question 16. What is the primary reason for performing regular hand hygiene in a healthcare setting? A. To make hands feel clean and refreshed. B. To remove visible dirt and debris from hands. C. To prevent the spread of microorganisms and reduce healthcare-associated infections. D. To meet the requirements of external auditing bodies. Answer: C. To prevent the spread of microorganisms and reduce healthcare-associated infections. This question addresses the fundamental principle of infection control, focusing on the purpose of hand hygiene. The keyword primary reason emphasizes the core objective behind this essential practice. Regular hand hygiene, whether through washing with soap and water or using alcohol-based hand rub, is the single most effective measure to prevent the transmission of pathogens between patients and healthcare workers. For example, performing hand hygiene before and after every patient contact significantly reduces the risk of spreading bacteria. Always remember that consistent hand hygiene is your most powerful tool in combating healthcare-associated infections. Question 17. A patient tells a nurse that they are planning to end their life. What is the nurse's immediate ethical and professional responsibility? A. Maintain confidentiality as requested by the patient. B. Document the conversation for review at the next team meeting. C. Immediately assess the patient's risk and escalate the concern to the appropriate team members. D. Advise the patient to seek professional help independently. Answer: C. Immediately assess the patient's risk and escalate the concern to the appropriate team members. This question addresses a critical ethical and professional responsibility in safeguarding patients who express suicidal ideation. The key phrase "planning to end their life" indicates an immediate and serious risk to the patient's safety. In such situations, patient confidentiality is overridden by the duty to protect life, requiring an immediate risk assessment and escalation to the multidisciplinary team. For example, this might involve notifying a doctor, mental health team, or duty manager to ensure the patient receives immediate support and safety measures. Always remember that patient safety, especially when there's a risk of harm to self, is the paramount concern and requires immediate action. Question 18. When taking a patient's oral temperature, what is the average normal body temperature for an adult? A. 35.0°C. B. 36.0°C. C. 37.0°C. D. 38.0°C. Answer: C. 37.0°C. This question tests basic knowledge of vital signs, specifically the normal range for adult body temperature. Understanding average normal values is crucial for identifying when a patient's condition deviates from the healthy baseline. While a range exists, 37.0°C is widely recognized as the average normal oral body temperature for an adult. For example, a temperature significantly above 37.0°C might indicate a fever, while one significantly below could signal hypothermia. Always remember that deviations from this average can be an early indicator of underlying health issues. Question 19. A nurse is caring for a patient who is confused and repeatedly tries to get out of bed unassisted, despite being a high fall risk. What is the most appropriate intervention? A. Apply physical restraints to prevent them from falling. B. Place the patient in a room furthest from the nursing station. C. Increase regular observations, ensure the call bell is within reach, and consider a bed alarm. D. Tell the patient firmly to stay in bed. Answer: C. Increase regular observations, ensure the call bell is within reach, and consider a bed alarm. This question addresses patient safety and fall prevention, particularly for a confused patient. The keywords confused, repeatedly tries to get out of bed, and high fall risk indicate a need for proactive, non-restrictive interventions. The most appropriate approach focuses on enhancing supervision and using assistive technology to prevent falls while maintaining patient dignity. For example, a bed alarm alerts staff when a patient attempts to get up, allowing for timely assistance. Always remember that interventions should prioritize patient safety without resorting to restrictive measures unless absolutely necessary and clinically justified. Question 20. Before a surgical procedure, a patient expresses anxiety and asks many questions about the surgery. What is the nurse's best response? A. Tell the patient not to worry, everything will be fine. B. Advise the patient to ask the surgeon during their next visit. C. Listen attentively, answer questions truthfully, and provide reassurance where appropriate. D. Offer a sedative to calm the patient down. Answer: C. Listen attentively, answer questions truthfully, and provide reassurance where appropriate. This question tests effective communication and patient advocacy in managing anxiety before a procedure. The patient's anxiety and many questions are clear indicators that they need support and information. The best response involves active listening, providing accurate information within the nurse's scope of practice, and offering appropriate emotional support. For example, explaining what to expect before, during, and after surgery can significantly reduce a patient's fear of the unknown. Always remember that open and honest communication helps build trust and empowers patients during stressful times. Question 21. What is the correct method for disposing of a used hypodermic needle? A. Recap the needle and place it in the general waste bin. B. Break the needle off and place it in a sharps container. C. Immediately place the uncapped needle into a sharps container. D. Place the needle in a plastic bag and then into the general waste bin. Answer: C. Immediately place the uncapped needle into a sharps container. This question assesses critical knowledge of sharps safety and waste management to prevent needle stick injuries and infection transmission. The keyword correct method emphasizes the importance of following strict guidelines for safe disposal. Needles should never be recapped, bent, or broken, but instead immediately placed, uncapped, into a puncture-resistant sharps container at the point of use. For example, this prevents accidental needle stick injuries that could occur if handling a recapped needle or one improperly disposed of. Always remember that safe sharps disposal is paramount for protecting both healthcare workers and the public. Question 22. A patient asks about the results of their recent diagnostic tests. What should the nurse do if the results have not yet been reviewed by the doctor? A. Tell the patient the results are normal to avoid worry. B. Inform the patient that the doctor will discuss the results with them as soon as they are reviewed. C. Provide a general overview of what the test indicates. D. Access the results and explain them to the patient directly. Answer: B. Inform the patient that the doctor will discuss the results with them as soon as they are reviewed. This question tests professional boundaries and appropriate communication regarding diagnostic results. The crucial information is that the results have not yet been reviewed by the doctor, meaning the nurse does not have full context or authority to interpret them. The most appropriate action is to manage the patient's expectations respectfully and explain the process, reinforcing that the doctor will provide a comprehensive explanation. For instance, saying, "The doctor needs to review all your test results together to give you the full picture, and they will discuss them with you soon," is a truthful and professional response. Always remember that interpreting test results is typically the responsibility of the doctor, and it's best to allow them to do so after their review. Question 23. What is the primary purpose of fluid balance charts in patient care? A. To document the patient's daily food intake. B. To track the patient's sleep patterns. C. To monitor and record all fluid intake and output over a specific period. D. To assess the patient's cognitive function. Answer: C. To monitor and record all fluid intake and output over a specific period. This question focuses on the utility of a common clinical tool, the fluid balance chart. The keyword primary purpose directs attention to its main function in patient assessment. A fluid balance chart is used to accurately measure and document all fluids a patient consumes, intake, and excretes, output, over a set period, typically 24 hours. For example, this helps identify issues like dehydration, fluid overload, or kidney dysfunction by providing a clear picture of the patient's hydration status. Always remember that meticulous fluid balance charting is essential for effective patient management, especially for those with renal or cardiac conditions. Question 24. A patient is prescribed a medication to be administered PRN for pain. What does PRN mean in the context of medication administration? A. Administer only if the patient requests it. B. Administer every hour regardless of pain level. C. Administer as needed or when required. D. Administer only in the presence of a doctor. Answer: C. Administer as needed or when required. This question tests knowledge of common medical abbreviations used in medication prescribing. Understanding PRN is crucial for administering medications safely and effectively according to patient need. PRN stands for pro re nata, a Latin phrase meaning as needed or when required, indicating that the medication should only be given if the patient exhibits specific symptoms or requests it within prescribed parameters. For example, a PRN pain medication is given when the patient expresses pain, not on a fixed schedule. Always remember that PRN medications require nurse assessment to determine if they are indicated based on the patient's condition. Question 25. Which of the following is the most effective way for a nurse to prevent the spread of Clostridioides difficile, C. diff, infection? A. Wearing an N95 mask at all times. B. Using alcohol-based hand rub before and after patient contact. C. Wearing gloves only when directly touching the patient. D. Washing hands thoroughly with soap and water after patient contact and before leaving the room. Answer: D. Washing hands thoroughly with soap and water after patient contact and before leaving the room. This question focuses on specific infection control practices for a challenging pathogen. The keyword most effective way emphasizes the crucial role of hand hygiene in preventing C. diff transmission. While alcohol-based hand rub is effective for many pathogens, it is not effective against C. diff spores. Therefore, thorough hand washing with soap and water is essential to physically remove the spores from the hands. For example, this is especially important when caring for patients with C. diff diarrhea. Always remember that for C. diff, traditional soap and water hand hygiene is superior to alcohol-based rubs.